Hey everyone, welcome back to Fab Dandy Health. Have you ever looked at your nails and noticed they're discolored, thick, or just not looking right? If so, you might be dealing with a fungal infection, and trust me, you're not alone. Believe it or not, about 1 in 10 people will experience this at some point in their lives. But don't worry, because today we're diving into how to spot a fungal nail infection and, most importantly, what you can do to fix it. Stick around because by the end of this video, you'll have everything you need to tackle this pesky problem head on. What are fungal nail infections? Let's start with the basics. What exactly is a fungal nail infection? Simply put, it's a fungal overgrowth that sneaks its way into your nails, usually starting underneath the nail bed. The medical name for this is onychomycosis, but don't worry, you don't need to memorize that. Fungi thrive in warm, damp places, which makes your nails, especially your toenails, the perfect target. Anyone can get a fungal nail infection, but they're more common in older adults, people with weaker immune systems, and those who frequently have their nails in moist environments, like swimmers or gym goers. The good news, these infections are treatable, and the sooner you catch them, the easier they are to deal with. But here's the catch. Fungal nail infections won't just disappear on their own. If left untreated, they can spread to other nails, cause pain, and even lead to permanent nail damage. That's why it's so important to recognize the signs early and take action. So let's talk about how to spot them. How to spot a fungal nail infection. All right, let's talk about the warning signs. Fungal nail infections can look different depending on the type of fungus and how bad the infection is, but here are some of the most common red flags to watch for. Discoloration. Your nail might turn white, yellow, brown, or even green. Sometimes small white or yellow spots appear and slowly spread. This happens because the fungus messes with the nail's normal growth and color. Thickening. Infected nails often get thicker than usual, making them tough to trim. This happens because fungal debris builds up under the nail, causing it to harden. Brittleness. Your nail might become weak, crumbly, or start breaking easily. The fungus slowly damages the nail structure, making it fragile. Distorted shape. Instead of looking smooth, your nail may start to look warped or curved in weird ways. This is a sign that the infection is affecting how the nail grows. Debris under the nail. You might notice a crumbly buildup underneath, which can make the nail lift away from the nail bed. This is one of the clearest signs of a fungal infection. Foul odor. In some cases, infected nails can give off an unpleasant smell. That's because the fungus releases waste products that create a distinct odor. If you're noticing one or more of these symptoms, there's a good chance you've got a fungal infection. But don't worry, next, let's talk about what you can do to get rid of it. What causes fungal nail infections? Before we dive into treatments, let's take a quick look at what actually causes these infections. Fungal nail infections happen when tiny organisms called dermatophytes invade the nail, but yeast and molds can also be to blame. These fungi love warm, damp environments, which is why they're so common in places like locker rooms, swimming pools, and even inside sweaty shoes. Certain factors can increase your risk, including walking barefoot in public places, gyms, pools, and public showers are breeding grounds for fungi. Always wear flip-flops or shower shoes in these areas to protect your feet. Wearing tight, sweaty shoes. Shoes that don't allow airflow create the perfect environment for fungus to thrive. Go for breathable materials like leather or canvas to keep your feet dry. Minor nail injuries. Even a small cut, crack, or damage to your nail can give fungi an easy way in. Weakened immune system. Conditions like diabetes, HIV, or autoimmune diseases can make you more vulnerable to infections. Aging. As we get older, our nails become drier and more brittle, making them more likely to get infected. Knowing what causes fungal nail infections can help you avoid them in the future. But for now, let's focus on how to get rid of them. How to treat fungal nail infections. Now for the good part, how to get rid of a fungal nail infection. The right treatment depends on how bad the infection is, but here are some of the best options. Over-the-counter treatments. For mild infections, over-the-counter antifungal treatments are a great place to start. These come in creams, ointments, or medicated nail polish. Look for ingredients like clotrimazole, terbinafine, or undesolenic acid. These are known to fight fungus effectively. Here's how to use them. Clean and dry the affected nail thoroughly. Apply the treatment as directed, usually once or twice a day. Be patient. Results take time. It can take weeks or even months to fully clear up, but consistency is key. Just remember, over-the-counter treatments work best for mild infections. If yours is more stubborn, you might need a stronger approach. Prescription medications. If over-the-counter treatments aren't doing the trick, it might be time to visit a doctor. They can prescribe stronger oral antifungal medications like terbinafine or itraconazole. These work from the inside out, targeting the fungus at its source. However, oral medications can come with side effects, so your doctor will monitor you closely. They're usually recommended for more severe infections, especially if the nail is painful or the fungus is spreading. If that's the case, a prescription might be your best bet for getting rid of the infection for good. Medicated nail polish or creams. Another option is prescription-strength medicated nail polish or creams. These are applied directly to the infected nail and the surrounding skin, making them especially useful for mild to moderate infections. Since they work on the surface, they're not as fast-acting as oral medications, but with consistent use, they can gradually clear up the infection. Your doctor may also recommend filing down the nail before applying the treatment to help it absorb better. If you're looking for a targeted, non-invasive option, this could be a great choice. Laser treatment. For stubborn infections that won't budge, laser treatment is another option. This method uses a laser to target and destroy the fungus without harming the nail or surrounding skin. It's completely non-invasive and painless, making it a popular choice for those who want to avoid medications. The downside? It can be pricey and often requires multiple sessions to be effective. While some people see great results, it's not a guaranteed fix for everyone. But if other treatments haven't worked, it might be worth considering. Home remedies. Now, let's dive into some home remedies. While they may not be as powerful as medical treatments, some people find natural options helpful in managing mild infections. Here are a few you can try. Tea tree oil. This oil is known for its antifungal properties. Just apply a few drops directly to the nail daily. Apple cider vinegar. Soak your nails in a mixture of vinegar and water for 15 to 20 minutes each day. Baking soda. Make a paste with baking soda and water. Apply it to the affected nail and rinse after 10 minutes. Keep in mind, home remedies work best for mild infections or as an extra boost alongside medical treatments. If your infection isn't improving, it's time to consult with a doctor for a more effective solution. How to prevent fungal nail infections. Now that you know how to treat fungal nail infections, let's talk about how to keep them from happening in the first place. Here are some simple tips to help keep your nails healthy and fungus-free. 1. Keep your feet dry. Fungi thrive in moisture, so make sure to dry your feet thoroughly after showering or swimming. 2. Wear breathable shoes. Choose shoes made of natural materials like leather or canvas, which allow your feet to breathe. 3. Change socks regularly. If your feet tend to sweat a lot, make sure to swap out your socks throughout the day. 4. Avoid walking barefoot in public areas. Always wear flip-flops or shower shoes in places like locker rooms and swimming pools. 5. Trim your nails properly. Keeping your nails short and clean can help reduce the risk of infection. 6. Disinfect your tools. If you get manicures or pedicures, make sure the tools are properly sterilized to prevent any bacteria or fungus from spreading. By following these simple tips, you can significantly lower your chances of getting a fungal nail infection and keep your nails in top shape. When to see a doctor. Lastly, if your infection isn't improving with treatment, or if you're noticing pain, swelling, or redness around the nail, it's time to see a doctor. They can confirm the diagnosis and suggest stronger treatments if necessary. In addition, if the infection is affecting multiple nails, or if you notice any changes in the color of your skin around the infected area, it's important to seek medical advice. Persistent or severe infections may require oral medications or specialized treatments like laser therapy that only a doctor can provide. Also, if you have a weakened immune system, such as from diabetes or an autoimmune disease, it's best to consult a doctor early on. Fungal infections can spread more easily and be harder to treat in these cases. Remember, early intervention is key to preventing the infection from spreading or causing permanent damage to your nails. Don't wait. Getting professional help can make all the difference in protecting your nails and overall health. And that's a wrap. Now you know exactly how to spot a fungal nail infection and what steps to take to treat it. If you found this video helpful, don't forget to give it a thumbs up and share it with anyone who could use this info. Make sure to subscribe and hit the bell icon so you never miss a new video. Thanks for tuning in, and I'll see you in the next one. Take care of those nails.